Good morning, everybody, and happy Tuesday. Welcome back to your Lunch Break Live. My name is Ivana. If you are new here, if you have been watching this show for the past year, almost a year, which is crazy to say, thank you so much. I'm glad you're back. Today, I was planning to be joined by our own Lita Gore, who is going to walk us through this new COVID-19 vaccine dashboard provided by the Alabama Department of Public Health. But unfortunately, it's still we are still in the working from home phase. We're having some technical difficulties. Hope you'll excuse me for being a few minutes behind. But we couldn't get Lita on here, so we are just going to talk about it. She's going to send me some notes that she had that she wanted to convey about this dashboard, and we're just going to walk you through it. So let me pull that dashboard up here. As you can see, this is something that the Alabama Department of Public Health has recently created to show the amount of vaccines that have been administered across the state. Now, this is accessible to everybody. It is from the Alabama Department of Public Health's website. I can put the link here if you are interested in seeing this. But as you can see on this page, there have been 226,250 vaccine doses allocated to the state of Alabama, and that's excluding allocations to federal programs that are administered here in the state. So you have that large number that is on the top of that box there, and that is the total vaccine doses allocated. Now, the vaccine doses that are administered now are just over 40,000. That's 42,810. Big difference there in the amount of vaccine doses that were allocated to the state and then that have been administered in the state. You can see that difference there. So again, this is all provided by the Alabama Department of Public Health. This is nothing that we created. This is all of theirs. Now, if you move over to the left side of that screen and you see those graphs right there, those graphs, you can see it shows you the weeks where the vaccine doses had been administered, and you can see the purple and the blue that represent Moderna and Pfizer. Now, I'm going to pull you out here. I do think we got Lita on from I think we got our technical difficulties resolved. Let's see if we have her. Lita, can you hear us?
Yes, I can. Can you hear me?
I can. Perfect.
Yay.
I'm glad we got you here. I was telling everybody, just because it's not 2020 anymore doesn't mean that we do not have technical difficulties.
Well, and I may be a moving target here for a minute while I get everything sorted. I have an iPad stuck on a laptop, so we're good.
That's fine. Lita, thanks for making this work. Now, we were just walking through this dashboard. I'm looking at so many of our comments of people that have very strong opinions one way or the other about a vaccine, but I have heard from Nicole who said she's already received her first dose and she feels fine. So, Lita, tell us about this dashboard and why this is important.
Well, this dashboard is showing us where we are on the vaccine path that it's pretty basic right now, just like the COVID dashboard was basic when it first started. And as we go, things will change and they'll get added onto. The concerning part of this dashboard is that vaccine doses administered versus how many we've been allotted. My math was showing less than 20. We've only given out about 20% of the vaccine that we've even been allotted. And I think there's a lot of questions now that are being raised about why we're not moving quicker, why it is taking so long to get some of this vaccinations done. I know we had holidays that came up and people were out, and but the slowness with which we seem to be rolling things out has become a concern.
Right. And you can see that huge number of the doses that have been allocated to Alabama versus, like you said, that smaller number of those doses administered. Quick question, Lita, if you know the answer, of that 226,250, those doses, is that just vials of the vaccine in general, or is that amount of first doses available and the second doses, are those included in that number?
No, I think this is all first doses. Because we're not to the round. We're getting close to some of our people having second doses, but this is first doses. Alabama started with healthcare professionals, and we've gone into nursing homes and VAs. But we've not, we have 300,000 healthcare professionals in the state, and so I have heard from friends and from those whose family members are in the healthcare profession, that is varying widely from place to place. The rules that may be used in North Alabama to provide some of that info is not the same as it is, or to provide those vaccines is not the same as it is in South Alabama or Birmingham. So you're definitely seeing a difference. And I know we have a plan and we're working that plan, but I think a lot of people, including myself, would like to see it sped up a little bit.
Right. I think that's something most people can agree on that are at least wanting to get that vaccine. Now, something I think is interesting is this graph has the color coding, right?
Mm-hmm.
Now, that purplish color that you see that is on the far left tally, that bar graph is all purple, and that represents the amount of Pfizer vaccines. So that's 7,752 Pfizer vaccines for the week administered, the week of December the 19th. Now, you go in that next week, there's a little bit above 10,000 of the Pfizer vaccines and about 2,500 Moderna. But then you get into the first week of the year, and that's this week, starting on January the 2nd. You have more Moderna vaccines that have been administered than Pfizer. We've got just one dose under 12,000 for Pfizer and 10,333, for Moderna, and then 10,333 for Pfizer. Now, Lita, do we know if there have been equal amounts of each dose administered to places across the state, or is it kind of a free-for-all in the sense that you don't get to pick the brand you're getting?
No, I don't believe you do get to pick the brand. Pfizer was the first out, but Pfizer has some requirements on their vaccine that Moderna does not, which is basically storage. So the Pfizer vaccine could only go to, I think it was 17 hospitals that were capable of providing that sort of ultra cold storage. But then you had the Moderna, which is a little bit easier to manage, and it's gone out. I think the Pfizer really was to hit those big metro areas, your Birmingham's, your Huntsville's, your Mobiles. And then we saw, Moderna with coming out, and there's some new vaccines that are even headed down the pike right now. I know my husband has been vaccinated and he's received his first round, and he was not asked. I had to ask him, please go ask what kind you got, just because I was curious. But it was not sort of, do you want Pfizer or Moderna? It was just, here's your vaccine. He's due for his follow-up January 21st. So,
I do have to ask, and I know that we had Scott Harris a couple weeks ago address some of these questions, but we do still have people that are unsure about the vaccine, which Dr. Scott Harris, the Alabama's kind of leader of health here in the state of public health, he had said, look, I understand being wary, do your research, but we still have some people even here in our comments talking about their worries, especially people talking about the first vaccine that is coming out very quickly using the mRNA technology. And people are worried about it. Now, is the State Department of Health doing anything to curb those worries?
Well, I think that's why you saw all that. People question, why do lawmakers get a vaccine? Why does the governor get a vaccine? Why does, we're broadcasting these doctors, but it is to offer some of that reassurance. Scott Harris was very clear and said, I'll take the vaccine, as soon as I can get it. I think that's the public awareness campaign that's out there, is we're willing to do it. I saw yesterday where I think New York has given their second dose of vaccine. So that was the first time we've seen that roll around. I have concerns and questions like everybody else does. But I think a lot of those things, you're not going to know in 2 weeks or 3 weeks. What we do know is that for right now, unless you're having some allergy related issues, which seem to be very small, I know in our household, my husband claimed that it made him sleepy and had to take a nap. I really question that theory. I think he just wanted to take a nap.
Understandably so. Napping is one of my favorite activities. So if I can blame that on something, I definitely will.
Yeah,
now,
that was more like what it was. Yeah.
Right. I've got a lot of questions about people saying, look, when do I know it's my turn? And I'm hoping to get somebody on here this week who can address some of those questions for everybody. But Lita, in the meantime, I know that I've had family members who have also received their vaccine. And most of these people were contacted by the department administering the vaccines. They didn't actually go out and sign up for different,
how
you can
same thing. Yeah.
Correct. You don't have to go to the pharmacy and sign up. These people, these healthcare workers have been contacted and said, hey, it's time for you to go get your vaccine. You need to show up at X place at X time to receive it.
Yeah. And I think that was, my mother's also in healthcare, and she has not gotten her vaccine yet. She's scheduled next week. And that's what happened. The clinic approaches and says, this is our vaccine date. In my husband's case, it was he had to go online and sign up for a particular time. But we're not rolled out to the public yet. We're not even rolled out to all healthcare workers yet. I mean, it's obvious if we've only used 20% of our allotment, we got a long way to go. Now, you know, there are some counties that we are hearing are further along, and they're going into more nursing homes. They're going to the next round of healthcare providers, first responders, police, firemen, teachers. I'm working on a story now about, you know, where do teachers fall on this? And the State Department of Education is saying February. They hope to have all teachers done by March, so that once spring break is done, the kids are back in school full time. But, you know, they have said from the very beginning, and this has been very consistent from Fauci on down to the Alabama people, that widespread vaccinations are not going to happen until late spring, early summer, June, July. And when we get to that point, you know, CVS, Kroger, all these places have signed on, Walmart, all these places have signed on to do vaccines. I think it will be just like COVID testing was in the beginning, where there was sort of like this, where do you go? And now you can go almost anywhere. I think you will be inundated, you know, with get a COVID vaccine and get a $10 gift card to Publix, you know, like they do a flu vaccine. I think you will see a lot of that.
And let's remember too, Dr. Harris said a couple of weeks ago that there would be no charge for people to receive their vaccine. And that, again, that's leaving insurance out of this. Insurance might be paying some money to the companies if you have insurance, but there will be no out-of-pocket cost for this vaccine.
And, you know, some states are even doing drive-up clinics where you are going in your car and you're getting your vaccine. Now, I did question, I've not looked a lot at that, because I know there is, like, after you get your vaccine, you have to wait a period of time to make sure you're not having an allergic reaction. So I don't know if they're just pulling people over and saying, hey, park here for 30 minutes and let's see how it goes. But, you know, I think we will start to see that, just like we saw with the COVID vaccine, that once that rollout gets going, and I don't think that's necessarily a bad thing. You know, I think I think there's a balance we've got to weigh between a slow approach, and we've only given 20% of our allotted vaccine, because I think the slow approach does give some people some reassurance. They've got a couple of weeks to see how things go. But at the same time, in Alabama, our numbers just keep going up, and our hospitalizations have topped 3,000 for the first time. And that is very concerning. And so I'm hoping we will, you know, vaccinations aren't going to solve that problem overnight.
Right. I want to answer a couple of quick questions on here about that people have asked. Now, number one, I don't have the name in front of me. It might have been Amanda who asked a question about the difference for that 42,000 doses administered and the 226,000 allocated. That is not a surplus because there are people who don't want to get vaccinated. Let me make that clear. That is just doses that have not been given out. And it's not because that difference in those two numbers is not because people did not want to take them. They just have not been given out.
We just haven't gotten it to them yet. Yeah.
Correct.
It's a providing issue, not a, I mean, there are some people who will choose not to take it, which is certainly, you know, and Alabama lawmakers have worked on some laws to make that where, you know, we will be guaranteed that you don't have to take it. But no, that is not a surplus. It's not sitting there begging someone to take it. We've got to get it out better.
Right, exactly. I just wanted to make that clear. Second of all, I've got Yassine. I'm sorry if I mispronounced your name. And they ask about saying, it looks like it's going to take a while. Do you have specific dates for different age ranges? And Yassine, we do not right now at the moment. We do not have a specific day by saying, you know, January 1, this next phase will get it. That has not been provided. There seems to be some sort of issue or maybe multiple issues with why this rollout has been a little bit slower than expected. We're waiting to get answers on that and as to to maybe why that is and how we can get this sped up. But we do not have any specific date ranges right now for moving on to the next phase. We do know that healthcare workers have been assigned that first phase along with the nursing home residents. And Lita, from my understanding, we're still working on getting those nursing home residents vaccinated along with healthcare
absolutely.
workers.
Yeah, and there's a process with all of this. When you go into a nursing home, some people have the ability to consent, some people do not. You run into some of those issues. Everything's not just line everybody up and shoot them up. And however, from personal anecdotes I have people reach out to me who say, my husband is a healthcare provider, my wife is a healthcare provider, and they're not even offering it to their clinic yet. So I think we're going to see. I think this number will draw some concern.
Honestly, it should draw some concern. That's like you said, about 20% of those doses that are sitting in freezers right now have only been administered. Again, we're trying to figure out why that is. Now, I have a question here that I don't know the answer to, but maybe somebody watching does. Jody asks, is there a group somewhere for those of us who have family in ICU that can talk to each other?
I don't know. That's a really good question.
Well, anybody watching, if you can help, Jody said that she's got family in ICU. She wants to talk to other people that are going through the process. If there's a Facebook group or any other group, shout it in the comments here. I'm sure there are multiple people and there's families that could really benefit from that group if it exists. So,
and I would also reach out to your hospital who has a chaplaincy program or who has an ombudsman. There are some resources through the hospital, some support groups that they could connect you also.
That's a good point. That's a good point, Lita. And Jody, we're thinking about you. Hope that your family gets better. I've got a question here from Nunu, Lita. I'm not sure if you're comfortable answering this. I will, but Nunu asks, are y'all taking the vaccines? Nunu, whenever it gets to my phase of the vaccine rollout, I will be taking a vaccine. I don't know if Lita, you want to answer that, but
sure, I'll be glad to. I have done my research and I'm very comfortable taking the vaccine. Just like I take all my vaccines and my child is vaccinated. And, but I did my research also. I read independent sources, not what my uncle said on Facebook. Sorry, uncle. But yes, I'm very comfortable. It was interesting. I was actually very excited the day my husband got the vaccine, because I felt like I had been concerned the whole time. He was at work the whole time. That we at least were making some progress, and we did, watch for side effects. Like I said, other than a minor sore arm, which he said was basically a mosquito bite. On the plus side, I will tell you that he said the vaccine itself was super easy. It was not a hard vaccine to get. We've all had like vaccines that are a little tougher, and he said this one was not.
Well, I've got one of my friends, Elizabeth, here. She's saying she'll be taking it too. So I know everybody definitely has strong feelings one way or the other about it, but that is at least Lita and my getting it here, and Elizabeth as well, getting her vaccine as well. So I'm just looking through, seeing if there are any more comments we can look through. Jody said she's going to check with the hospital, see if they can find any groups for her there. And, I think that mainly, Lita, we have so many people saying, when are we going to speed this process up?
That's Lita's asking the same question. We're working on that now. This dashboard is super new. I mean, we're talking 2 weeks old. And it like I said, it really does remind me early on of that coronavirus dashboard where it is just basic. Like there's not a whole lot to it. It doesn't have demographics. It doesn't have geography. Because these 42,000 doses we've given, where? I know, I think it was Huntsville said they've done 16. And I could be off on that number. That's just, they had done a high number. Mm-hmm. I think we will see some pressure being applied in the coming days to step this up.
Now,
let me say this real quick. Mm-hmm. In the defense of the health department, I am glad they are at least being very transparent with the number they have given. So at least, because this does not look good. And so at least they are showing us the nuts and bolts of what's got to be done.
I think that I know I at least have this question, and that is, it looks like on this bar graph that you can see on the left side of the screen right there, or the left side of the ADPH screen. Now, the bar graphs are showing it by weeks, the amount of doses administered by week. Is this dashboard only going to be updated once per week?
Right now, but um, in those early days, the coronavirus dashboard was updated once a week, and the school dashboard has been all over the place. So I think it's just a matter of time. I would love to see it by day, but we've been asking for some demographic info on the coronavirus, like the main coronavirus dashboard, since March, and it's either not available or for other reasons they can't release some of that information. Because I mean, I had been watching this today. They said it was going to update. I was watching, yesterday and today, and I think people are really going to want to see, and I think we will see this. I want to know by day. I would love to know where, by county. That would be incredibly interesting. And I think we will start to see some of that as we get further along. And again, we ran into Christmas, we ran into New Year's Day, and while healthcare professionals work 365 days a year, there are web designers who don't, or testing people who don't. And so I think we've got to, let's give it a week and let's see if we can't get back into a better flow of information, because we didn't have hospitalizations for, I think, 3 days. We were waiting on the same number for about 3 days, and it just hit the end of the year.
Right. Now, 2 quick questions for you, Lita. One from Ronnie. Ronnie, when are people age 70, going to be able to get the vaccine? Ronnie says that he does plan on getting his vaccine. Now, Lita, is Ronnie in that next phase of people?
Yeah, he's probably going to be, all things considered, if his health is good, which I hope it is, he would probably be spring, like mid to late spring. I think you're going to see people with underlying health conditions go first. Now, in Alabama, to say you are a certain age group with an underlying health conditions, if we include obesity and diabetes and high blood pressure, that is a high number of people. But again, we're going to get to, I don't want to say assembly line in a bad sense, but we're going to get to a much quicker process, just like we did with coronavirus testing, where we are doing, more mass vaccination than what we're doing now, which is extremely targeted and limited, and I think by design.
One more question for you, Leader, and it's from Susan. And Susan, you talk about the people in next in line, especially those that have underlying conditions. Susan asks, the medically vulnerable, have they been bumped down in the priority list? And if those people are dying in the highest numbers, why are those people not in the next phase?
No, I don't think they have been bumped down on the priority list. I think Alabama's priority list has stayed the same. Every state is a little bit different, but those have been pretty set the whole time. I think you started with healthcare workers for an obvious reason, because if you don't have the healthcare workers, then the medically vulnerable are even more vulnerable. And then I think we went into nursing homes, and here's where you run into some issues. Any place that's congregate housing, it raises questions about dorm rooms, but we've seen that younger people seem to have better outcomes. So I think that's why you're not targeting that as much. But our nursing home population paid such a heavy price that I think they're going to those areas where people are medically vulnerable, they're older, and they're living together, as opposed to someone who could isolate in their home. But no, it has not changed. That we've not seen a wholesale change moving up and down. And they've not really said, okay, we are now entering stage 1B. It just seems to be more of a fluid process right now.
Right. There are some things here, Lita, that I'm going to have to pass along to you to look into further. I know Susan's concerned, saying that medically vulnerable, she believes, have been moved to 1C instead of 1B. We've got somebody saying
I'll be happy
that.
to look at that, by the way.
If they absolutely.
And I looked at the plan again yesterday. I have not seen it, but I will look.
And then we've got somebody claiming that there's a health department who has been giving vaccines to anybody who shows up, and that is Reba. That is not supposed to happen. It is supposed to be for.
I don't think they would have access to the number of ones that have to show up. I think I would question what my vaccine is if that's
so. Hopefully, yeah. So hopefully that is not the case.
Information, yeah.
Absolutely. Hopefully that is not the case there, Reba. Hopefully that is not true. Now, one more question here. I know I keep saying that from Yassine. She says that she wants this dashboard to be updated every 24 hours, like we do the coronavirus dashboard for new cases. She says, "What do you think, Yassine?" I think that is both of mine and Lita's hopes. I think that's hopes for everybody who's keeping an eye on this dashboard instead of weekly. So, everybody, I think that's going to be it for today. I'm hoping to have some more people come on this week to talk about vaccines, talk about rollout, and maybe why this rollout is going slower than we expected. But Lita, thanks for jumping on, even in the midst of technical difficulties.
Yeah.
Absolutely. And everybody, thanks for watching. We'll see you tomorrow.